Thank you for joining us. Today's presentation, Bridging Communication, Speech Therapy, and Autism Support for Families. Our presenter today is Stephanie Ramirez. She is one of our lead speech pathologists here at NKC Health. Just a little bit about Stephanie. She is primarily focused on acute and outpatient rehab with adults. She's passionate about sharing information with the community and has been a featured speaker at several conferences, including the KU Concussion Symposium, STEM Saturdays at Union Station, and the Kansas Speech and Hearing Association. Stephanie enjoys spending time with her husband, her two children, Owen and Mia, and rooting for her alma mater, the Oregon Ducks. So thank you for joining us today, and I'm going to turn it over to our speaker, Stephanie.
Thanks. Thank you everyone for joining. I am going to turn my video off just because it was kind of glitching earlier and I don't want to distract from the presentation. But yes, as Bree said, I am a speech pathologist here at NKC Health. I do primarily work with adults, but I have lots of experience in my past of working with kiddos with autism. Elementary age all the way through high school, at the University of Oregon, actually. And I feel like this is just such an important topic, especially in this world where I think there's a lot of, you know, questions going around and people are just looking for resources. So I hope that you can leave today with some new insight, maybe some ideas for how to help if you have a child with autism at home, and just maybe how to get things started. We have, just to kind of give a little plug, four amazing outpatient speech pathologists who specialize in pediatrics. We did not always offer pediatric therapy here at NKC Health, but I'd say 5 or 6 years ago, we just saw such a need, and our pediatric group saw such a need that we really wanted to step up and help the community. And so we do provide therapy. So a lot of times, you might have wait lists getting into some place like Children's Mercy. We usually can get kiddos in within 2 weeks. So hopefully that will also help kind of give you some resources. And I'll certainly give you some more information at the end if you are interested. Okay, so just starting out talking about what is autism. Autism spectrum disorder, or ASD, you might see it referred to, is a neurodevelopmental condition that affects how a person communicates, interacts, and experiences the world. It's called a spectrum because it varies widely from person to person. So there are, so many different variations or presentations of autism that you may see. Some children may be nonverbal and need a communication device to help function. Some are very high functioning, verbal, go to college, have jobs, all of those things. So there is a really wide spectrum. When I was in college, one of the other clinicians kind of put it this way: when you meet a person with autism, you've met one person with autism. Everyone is different. And those signs that you might see usually appear early in childhood and last throughout the lifetime. But when you have the variations from person to person, different kids might present with different symptoms or signs at different times. So just some statistics. 1 in 31 children in the United States have a diagnosis of autism, along with 1 in 45 adults. Boys are typically a higher rate of autism than girls. They're 4 times more likely to be diagnosed. And in the United States, autism prevalence is lower among white children than other racial and ethnic groups. So higher in Hispanic, Black, Asian, Pacific Islander, Indian, and Alaskan Native. Around the world, 1 in 100 children are diagnosed with autism. So one thing that I want to bring up with this, because those numbers seem really high, and I don't think that autism itself is growing. I think that our outreach, our screening, the destigmatization of autism diagnoses has really increased people seeking out that diagnosis, where in years past, maybe they did not have access to getting a diagnosis or they were afraid to get a diagnosis. So a lot of times what I'll tell parents is really, a diagnosis is the first step in getting those supports that your child may need. And we really want to set them up for success. So that diagnosis is really what starts that. So some common characteristics you may see, as I said before, everyone with autism is different. However, you might notice differences in social communication and interaction. You might notice repetitive behaviors or specific interests. You might notice some sensory sensitivity. So maybe they have a reaction to sounds, textures, lights. You might notice strengths as well in memory, details, or those specific topics of interest. But again, these vary from person to person. Some early signs of autism that we're going to start talking about here. These would be things that on their own probably don't mean a diagnosis, but if you're noticing many of these signs, it might be a really good opportunity to talk with your pediatrician about what you're seeing. So first of all, with social communication, you might notice limited or no eye contact. You might notice difficulty understanding or responding to social cues or a lack of interest in social interactions. You might notice delayed use of gestures or absent use of gestures like pointing or waving, difficulty with what we call joint attention or sharing enjoyment or activity with others. Maybe they like to play on their own more than they like to play with their peers. And limited use of facial expressions. Going back to those repetitive behaviors and interests, you might notice very, very insistent on routine, difficulty with change or transition, repetitive movements like rocking, spinning, or hand flapping. Those can also be called stimming behaviors. Intense focus on specific interests, often to the exclusion of other activities. So maybe they're really into trains and they literally never talk about anything else or want to do anything else. Unusual play patterns, such as lining up toys or arranging them in specific ways. Now, again, a lot of these are normal childhood behaviors when you are noticing just a few of them. But again, if you're noticing all of them or a lot of them, that's when we would have some interest in kind of getting that looked at. Moving along, you might notice some differences in developmental delays with kids that have autism. So one of the big ones, of course, as a speech pathologist, we look for is delayed speech and language development. That's usually why kids are referred to speech therapy, is because they have a delay in that development. You might notice that kids with autism have difficulty imitating sounds or gestures. They may not participate or have difficulty with pretend play. They also might have delayed motor skills. So you might notice these kids crawling or walking later than their peers. And one thing that you might be aware of, some children with autism may develop typically for the first year or two of life, and then start to regress or lose their previously acquired skills. So maybe they were using words or two-word phrases, and then they all of a sudden stop doing that. That would definitely be a cause for concern. Some other signs, as I said before, kids might have sensory sensitivities, sounds, textures, tastes. A lot of these kids do have some feeding difficulties as well, which we also see in our clinic. difficulty understanding emotions in others or lack of joint attention, and difficulty with simple instructions. So again, it's important to note that these signs may appear at different ages and in varying degrees. So some children might show only a few early signs, while some may exhibit more pronounced symptoms. But again, if you're noticing a pattern or any of these early signs, it's really recommended to consult with your pediatrician or another healthcare professional to see if maybe an evaluation would be warranted. So you've seen some signs and you've talked to the doctor and you are interested in getting a diagnosis if that's what's going on. Again, babies develop at their own pace. Many don't follow exact timelines found in some of the parenting groups. So, as far as getting an autism diagnosis, we really don't see that typically before the age of 2. I've got those statistics up there. Usually the average age of diagnosis is about 5 and a little bit higher, 5.6 years old for girls. And that is interestingly after the average age of intervention. So usually these kiddos come in for some kind of therapy, whether it's speech therapy because they're not talking or using their words as we would expect, or feeding therapy maybe, or occupational therapy for some of those fine motor, or physical therapy for gross motor. And then maybe at that same time, they're going through the process for getting a diagnosis. So you can absolutely start therapy without having a diagnosis. So I want to get that, make that clear. Children with autism spectrum disorder usually show some signs of delayed development before they're 3. And I'm going to sound like a broken record, but talk to your healthcare professional about your concern. When you're getting the diagnosis, it usually consists of clinical interviews, observations, standardized tests. The pediatrician will get you started, and then there are further tests that need to happen. We, as speech pathologists, cannot diagnose autism. We can diagnose language delay or language disorders, but we cannot diagnose autism. So that will be a team of individuals. And again, your pediatrician can help you navigate through that process. Sometimes it does take a little while. So just be prepared for that. But again, you can be, your child can be getting intervention while that's happening. So there doesn't need to be any kind of a delay. And when we're talking about diagnosis, I do want to just briefly discuss the neurodiversity movement. So this is a social and disability rights movement that views neurological differences like autism, ADHD, dyslexia, etc., as natural variations of the human brain, not diseases that must be cured. So I really love that quote that I have on the side there. It's not broken, it just runs on different settings. And as a parent of a kiddo that has dyslexia, I can tell you that some of these kids are the most resilient, the most smart individuals that I have ever encountered. And therapy, really should be focusing on how to help them succeed, not making them appear, quote, less autistic. So we are working on their strengths. We're working on how to help them function in the world, how to communicate in this world, but we're not changing who they are. Another thing that has come up with this movement is that stimming, such as the hand flapping and the rocking and those behaviors that I mentioned earlier, should not be automatically stopped, that it's actually really important for these kids to be able to do that. A long time ago in therapy, eye contact was really focused in on. We do not force kids with autism to have eye contact. And again, masking or hiding those traits can actually harm mental health. So we really want to embrace everyone. We want to embrace their differences. Differences and different does not mean something negative. So If you're interested in learning more about the neurodiversity movement, there's a lot of great stuff online. And especially as a parent, I would really encourage you to look into that because it's very, very empowering. Okay, so we're going to go into our role as speech language pathologists and really how we can help. Therapy is a combination of supporting development of both verbal and nonverbal communication. We work on teaching social communication skills just to help navigate those interactions with peers. If needed, we can train augmentative and alternative communication, or AAC, such as, tablets, notebooks, speaking devices, just to help if the child is nonverbal or if they need some support. And we do a lot of collaborating with families, teachers, other professionals, as I mentioned, occupational therapists, physical therapists, but also teachers and psychologists. It really is a team effort, and the more that the team is communicating and on the same page, I think the better the outcome for the child. So really trying to make everything supportive and consistent. And we recognize that, a few hours of therapy each week is really not going to change a whole lot, but it's giving the parents the tools that they need to work with the child all the other hours in the week. That's really where the magic is going to happen. So we want to make sure that you are prepared. And usually with therapy, we'll demonstrate some techniques and some ideas for home, and then give you that support so that you can carry it through. Of course, I'm biased, but I think the earlier that you can get into therapy, the better, because early support really does improve communication and social outcomes. It can really just start kids off on the right foot, as well as giving families the tools and support so that they feel empowered and really feel like they, have a direction. I think one of the things, when you receive a diagnosis, it's kind of like, well, what next? What do we need to do? Where do we go from here? And therapy can really be a way to get that direction. And again, that collaboration between professionals can help with consistent support across settings, whether it's at the doctor's office, whether it's in the rehab office, whether it's at school or at home. Really just making sure that we are preparing both the child and the family for life. So when you work with a speech pathologist, usually we will have goals set out based on the individual child's needs. So there are various standardized tests that we give that look at speech and language development. We also have usually questionnaires for parents to kind of learn about how the language delay may be impacting things at home. So based on the results of those, we may have goals for early communicators of things like requesting, labeling, imitation, just those early language skills. And then as they get older, we can expand those goals into more advanced communication, such as using sentences, answering questions, using description words. So very, age specific when we're thinking about goals. What is appropriate? What would we expect for this child's age? For receptive language, so comprehension, a lot of times we'll have goals for following directions and working on basic concepts like things like in or on, or big and little, first and next, just to help with those types of topics. We also can have goals for social communication. So we might work on identifying emotions or role-playing greetings. As I said before, parallel play and joint attention is sometimes a challenge. So we'll work on just parallel play. Therapy, particularly for pediatrics, is very much play-based. So, you might come in and you might see your therapist and it might just look like they're playing, with your child, but really there's so much more happening within the play that is really amazing. So things like turn taking, asking questions, describing things. So we're going to get into some activities that you can do at home. And a lot of these activities are ones that we actually use in therapy. For our older kids, when it comes to social communication, we might really work on conversation, scripting if that's needed. So just ways that they can interact with their world and have a little bit more confidence. Some other goals that we may have are for executive function. So these are the higher level kind of problem solving, decision making abilities. We might have speech sound intelligibility goals if the articulation along with the language is impaired. As I said, we can work on AAC or alternative communication. So we might have goals for that, teaching the child how to use their communication device, navigate the device. And we might have feeding goals depending upon if they have sensory aversions or difficulty with feeding. That is something that we work with our OT friends a lot on. So we can really be a one-stop shop. And as I said before, all the goals are really dependent on age, their level, what setting they're in. So are they spending most of the day at home? Are they going to school? Where are they going to be using these skills? And then, of course, any specific concerns or challenges that the parents are reporting that we can potentially help with. So I could not talk about therapy without mentioning ABA, or Applied Behavioral Analysis. So if you have been in the autism world for any length of time, you have most likely heard about ABA. ABA is defined as a structured treatment for autism spectrum disorder that uses behavioral principles, primarily positive reinforcement, to increase communication, social, functional life skills while reducing harmful or restrictive behaviors. ABA is something that's been around a long time. I do feel like there has been a lot of change when it comes to this type of therapy. Just like speech therapy, it is usually play-based learning, but they also add in structured teaching trials, routines. So they're going to work on some of those transitions that can be really challenging for kids. And they do a lot of parent coaching as well. So just to kind of illustrate the difference between ABA and speech therapy, I'm going to just give you a quick example. So if a child is screaming when they want a snack, a speech therapist might ask the questions, does the child know the word for snack? Can they make a request? Do they understand turn taking and communication? Do they need AAC? What's going to help them communicate that need? An ABA therapist might ask the question, why is the screaming working for the child? What happens after they scream? And can we teach a better way to reinforce asking calmly for a snack consistently? So we can address the same problems, but we have a different focus. Speech therapy is focused on the communication. ABA is really focused on the behavior. The structure of therapy is also very different. So again, speech therapy focusing on communication and language, very flexible developmental approach, usually 1 to 2 hours a week at the most. Whereas ABA is really looking at that learning and behavior. It's very structured, repetitive techniques, and they can work with children up to 10 to 30 hours a week. So a lot of time in intervention. A lot of parents kind of decide, do I want to send my kids to preschool or do I want to send them to ABA? Because usually that's about the same amount of time. And again, the best outcomes happen when teams collaborate. So I know that we have had some kiddos come in to speech therapy with their ABA therapist, and that has been really great. It's been great to collaborate, hear kind of what's working in their therapy, what's working in our therapy. And that way we can, again, approach things consistently so the kids don't get confused and they just have that really good consistency. There are various ABA providers in the area. So again, I just encourage you to talk to your pediatrician if that is something that you're interested in. We do not provide ABA therapy here at NKC Health. However, we could also provide a list of places in the region that you could get that. Okay, so moving into just some things to remind you as a parent what can be helpful when you have a child with autism. So I picked my top 10 here, and then we're really going to get into how you as a parent can help with communication at home. And, some of these are easier said than done. Again, as a parent myself, I completely understand. But we can't do better if we don't have goals. So here are some goals for us. So first and foremost, we want to be patient. We want to create safe spaces, and we want to take care of yourself. You cannot be a good caregiver without taking care of yourself. And sometimes that means asking for help from friends, family, again, community organizations, really celebrating the small wins, because it's really not about big leaps and gains with autism. What we're looking for is just small wins and a little bit of progress each day. I actually have a poster up in my office. A little bit of progress each day adds up to big results. So it's not about the big things, it's about the little things. Kids in general, they don't have to have autism. I think kids love routines. And so especially with children with autism, it's really helpful to stick to a routine. If you know that a specific situation is going to be difficult, you can take steps ahead of time to help minimize that or make that transition a little bit easier for them. I think meeting your child where they're at, accepting your child as they are, again, they're not broken, they're just different. And really leaning into the strengths can be very empowering. We in therapy really do try to play up to the strengths of each child and using that positive reinforcement, because who wants to do something if they're constantly getting yelled at or in trouble or feeling bad about themselves? We really want to create a positive environment and make therapy fun, and make doing these things at home fun too, so that they'll want to keep doing them. Okay, so for supporting communication at home, I think first and foremost, starting with following your child's lead. We can guide them to doing what we want them to do, but chances are, if it's something that they're already interested in, they're going to participate a lot better. So really looking at the things that they enjoy, the things that they're doing, and how can we build on that to make it a really great communication opportunity. We want to use clear, simple language, visual supports, and celebrate all communication. So if the child is gesturing, if they're using words, or if they're using their AAC device, all of that is a win, because they are communicating what they want, what they need, and they're learning that, wow, when I communicate, when I use these tools, I'm getting what I want. This is positive. So all communication is valuable. Reading together daily, talking about pictures and feelings. We're going to go into more detail with that. But obviously, those can be really great language opportunities, and routines, and reflection, and just bonding time. Okay, so when we're thinking about communication, just in general, on a day-to-day basis, First thing that's very important is to get their attention first. Say their name, position yourself at eye level. That will prevent you from having to repeat yourself, hopefully. Knowing kids, you probably will have to repeat yourself, but it will set you up for success. As I said before, using clear, simple language. So instead of saying something like, can you maybe think about starting to clean up soon? You might say, it's time to clean up our toys. So just really short, direct, um, giving them processing time. So give them a moment to process that information before you do the repeating or rephrasing. A lot of kids respond really well to visual supports. So I've given an example of a picture schedule over on the side there. So if the child is not reading yet, you can use pictures. If they are reading, you can certainly write down the words. But those can be great. Also having picture cards for choices, whether it's food or activities, that can really be helpful. Written reminders for older kids are still helpful. So having things written down that they can follow just makes it a little bit easier. We want to try to avoid idioms or figurative language. So things like, it's like a needle in a haystack, or you can't have your cake and eat it too. Sometimes kids with autism have difficulty thinking abstract. So really making things more black and white and not so figurative can be helpful. Again, offering choices. If we're going to give choices, we want to limit it to 2 to 3 options so that it's not overwhelming. And we want to really try to stay as calm as we can if there is a communication breakdown. Regulation is more important than communication. So if the child is dysregulated, they're not going to be able to communicate or really process what's going on at that moment. So really try to stay calm. And if you feel things escalating, maybe taking a step back, using some choices, and some of those tools that you can use to kind of make the communication easier. If you have an early communicator, one of the things that we can do to help build communication is to just talk a lot, narrate your daily activities, your feelings. While you're in the kitchen, oh, I'm going to wash these dishes. Oh, the soap is so sudsy and white and fun, and this water is so warm. And I just love washing dishes. And, whatever you're doing, it exposes children to language without the pressure to respond. And you better believe they are just like little sponges. They are, soaking all of that language in, whether they are verbal or not. Modeling language or functional phrases can be really helpful. So if the child is using gestures like pointing, and they point to juice, you might model juice, please, so that they can learn those functional phrases. You might expand on what they say. So if they're starting to say words and they say car, you might say red car. Yes, that's a red car. It goes fast. So you're just building on what they're already saying. We can create communication opportunities by doing things where they have to ask for something. So maybe you give them the snack of yogurt, but you don't give them the spoon. Or you pause before you give them the next puzzle piece or the next block. So that kind of goes into number 5, using strategic pausing. I do this a lot in songs, but you can do it in routines as well. So, when you're singing a familiar song, maybe you leave the last words off and the child can fill in the blank. They love that. They love that. And it builds confidence, it builds connection. And I just love that. So number 6, following the child's lead. So again, whatever they're interested in, if they like trains, again, going back to that, you might observe, like, wow, you've got a train there. Maybe comment, that train looks really fast, and then add language. So can we make the train go fast? And that's also good for joint attention because you are joining them in their activity. We want to avoid too many questions. Kids don't like it typically when they feel like they have to perform or when they're being interrogated. So if we're talking, if they're playing with the train, asking, what's that? What color is it? What's on the bottom? What are you doing with it? That can be kind of overwhelming. So really just trying to engage without interrogating. Some really good communication games. And again, you might see these when you come in for therapy. We love bubbles. Bubbles are very motivating if you have a young child. You can work on requesting more, more bubbles, blow again. And you can work on specific sounds like pop, pop, pop. Cars, again, are also really great. Ready, set, go. You have that familiar routine, the request, the joint attention. You might play toy hide and seek. So, where is it? You can tell them if they're hot, if they're cold. And then, who doesn't love a good game of hide and seek? Blocks can be really fun for turn taking. Again, describing, requesting, they need to ask for another block, or wow, your tower is getting so tall. It's so big. Dolls and animals can be great for sounds, for, again, emotions, routines, emotion charades. So you kind of act out the different emotions. This is really good for older kids. And books, again, I will have to say, for any age child, can be wonderful for just absorbing language, learning new language, building routines, building connections. If you haven't, definitely get over to the local library. They have so many amazing programs for kids and great books that you can check out. And, you don't need to invest a lot of money. There's a lot of really great free resources out there. I did want to put in a little slide for older kids just because they can present their own unique challenges. Some good games for conversation and language might be a would you rather game. Would you rather go to the beach or would you rather go to the mountains? And you can talk about that. 20 questions. So they have something that they have to describe and you have to guess it. Story building. So maybe each person adds a sentence to the story. Role playing can be really great, especially if there's specific interactions in their day that they have anxiety about or they want to practice. And working on specific conversation tips. So talking about the conversation triangle. So if somebody, says something to them, they have the idea of, okay, I need to make a comment, ask a question, and then make a connection. So if somebody says, oh, I'm going to my grandpa's house, you might say, oh, that sounds fun. That would be a comment. Where does your grandpa live? That's a question. And then connection. I really like spending time with my grandpa. And you can practice that for a lot of different situations. If kids with specific interests tend to dominate the conversation or kind of perseverate on their topic of interest, you might teach them the 2 questions rule. So they need to ask 2 questions. Again, kind of like the conversation triangle, the talk, ask, listen. So you say something, then you ask a question, and then you need to listen to what they tell you. You can practice conversation starters. And again, just practicing with those emotions. If they're not feeling like they're coming naturally, it's something you can definitely practice. So just my little soapbox, I think that as parents, as educators, as therapists, it's our responsibility to really build an inclusive community. We want to encourage understanding and acceptance. All children are different, but all children are special and unique. And really supporting inclusion in schools, workplaces, social settings to provide those opportunities. As I said earlier, focusing on strengths, not just challenges, very empowering, and really listening to those autistic voices and respecting neurodiversity. Temple Grandin is a really great speaker. She has autism. She's written a few books. If you are interested, I think she would be a great place to start, and then you can kind of go from there. I also just wanted to end with some myths because there are a lot of myths out there. The first myth is autistic children will talk if they just try harder. That is not true. Speech development does vary, and many children or people with autism benefit from alternative communication. Even if they can't speak verbally, as long as they can communicate, that's our goal. Myth 2, bad parenting causes autism. Absolutely not. That is a theory from decades ago. It has been, very debunked. But the cause of autism is a combination of genetic and environmental factors, and parenting style really does not have any influence on whether a child develops autism. Number 3, all people with autism are geniuses or have some kind of savant ability. Again, autism is a spectrum with a wide range of abilities, and while some people with autism do have exceptional skills, many do not. A lot of people with autism just have average intelligence like the general population. And then finally, number 4, non-speaking individuals cannot understand language. Many non-speaking individuals understand a great deal. And again, as long as they have their AAC device, they are able to communicate. So just because a person doesn't talk, we don't want to assume that they cannot understand. And I just wanted to share this quote. I really love it, from Kate Donahue. We are not trying to change our children to become neurotypical by taking them to therapy. We are equipping them with life skills and supporting them to grow and develop so they can thrive in their own unique way. And I know if you talk to any therapist working with kids with autism, I think they would absolutely agree with this. Just some resources. Again, I always like to leave parents with some resources. Autism Speaks is a national organization, as well as the Autism Society. They have some really, really great resources out there. There are local early intervention and therapy programs, and you are welcome to reach out to me or, again, your pediatrician to get some ideas for those. The local chapters of those national organizations also usually have some kind of support group and community education event. You're already at a community education event now, so you are one step ahead. But if you want even more, again, you can go to those national organizations and see what we have locally, or feel free to contact me as well. I can probably get you connected. So I would just like to thank you so much for listening, and together we can build a more understanding and inclusive community. So thank you so much. And I've got my information, my phone number down below.
Thank you, Stephanie. I really encourage you guys listening. If you have any questions, let's put those in the chat or in the Q&A while you've got the expert right here in front of you.
Well, I did a good job. Nobody has questions.
You did.
Or you're just processing all of this information, because I know it's a lot. But like Bree said, you'll get copies of this so you can kind of look at it and reflect on it. And I think, just looking at some of the strategies that I shared and kind of think, okay, what am I already doing? And maybe pick one or two that you want to try. It doesn't have to be every single thing, because not every single thing will be appropriate for every kid.
Agreed. And I would never underestimate the power of a support group.
Oh, yeah,
If you're not
absolutely.
in one, please seek that out, just to know that there's others that have children like yours, or maybe feeling the same way that you do. You're not alone,
Mhm.
and there is community around this. Well, somebody asked, is there a specific age limit for these services?
No. So basically, our program typically, we see kids from early intervention, toddler age, um, through school age. And then, school services can follow them all the way through. Private practice can follow them all the way through, and through high school. And then even for young adults, there are community programs. The Whole Person is a great organization that works with people that has various resources, employment opportunities, things of that nature. So really, there are lifelong supports. It just might, the setting where you get those supports may change. I also know that a few of the ABA clinics that I have talked to do age out at about, I want to say 8 years old. So
Okay.
they really focus on the younger kids for that ABA therapy.
Another question.
Mhm.
Our grandson is 18. He is autistic. One of the biggest communication problems is he's repeating himself and starting sentences over and over. How can I help him overcome that?
Oh, interesting. Um, it's a hard one to answer without knowing him, without seeing him. um I would suggest, honestly, if it's really a barrier, then you know thinking about talking to his parents to see if he could get evaluated. Sometimes it's not like a whole therapy program, it's just a couple sessions to kind of see what's going on and give some tools. So it's not as involved as some people might think. Um, I also feel like sometimes we have to ask ourselves the question, um, you know, who who is it disruptive to? So if they're, having some difficulty maybe restarting, is it bothering them or is it bothering us? And if it's not bothering them and they're able to get their point across and they're able to communicate what they need, maybe it's just a difference that we have to embrace. Um, but if it's something that seems like it's hindering them or bothering them, or, then it might be worth looking into some additional support. Same thing with like the stimming kind of behaviors. I think, you know, they might be distracting to us. They might be, um, you know, we might be bothered by it, but if it's not hurting the child, they're not, they're safe. Sometimes that behavior is very helpful to them, and it's really not something that we need to try to stop.
It's a good point. If it's a barrier and it's really affecting day to day,
Mhm.
that's one thing. Or is it just something that is different than how we communicate, and maybe it's all right.
Yeah.
Another question. Do you know if there's currently a lengthy wait list? I have a 12-year-old nonverbal child
Mm.
that's struggling with using his AAC device and would like to see if this could help.
Yeah. So we do not have a wait list. I know Children's Mercy usually has a wait list. The place, if you have an existing AAC device, we may be able to help. Um, the other place within Kansas City that is known for working with AAC is Ability KC. They have all of the AAC experts. So I would encourage you to get in touch with them. And I do not know if they have a wait list or not. But you don't know until you call and just get it started.
A thank you to that was the comment. And then the previous question about the repeating themselves, the child that was repeating themselves, they said, great point. We have gotten used to it and we understand, but the biggest concern is that it's hard for other kids his age to talk with him. And it's hard for him to make friends. Understood. Yeah, I can see that.
Absolutely. So yeah, I think it would be something that if it seems like it's a barrier, maybe it's a great idea to come in and take a look and see if there's something that, can help. A lot of times, kids with autism are rule followers. And so if you give them some rules or some things to remember, they're pretty good at doing that. So this sounds like maybe a situation where we can role play or rehearse, give some rules, conversation, strategies, and that might be helpful.
And maybe even exposing that child to other kids that are like them, that could understand that, this person's not really different than I am, and that they understand maybe some of those behaviors better than other kids.
Right, absolutely.
Great questions, guys. We appreciate your participation. Well, she said that he's definitely a rule follower. I'll talk to his mom and see if we can help with that in any way.
Wonderful. Yeah.
Thank you, and great presentation. Agreed. Great presentation, Steph.
Thanks.
Okay, guys. So again, you're going to get this PowerPoint if you registered for it. We'll also upload it to our YouTube channel. So go check out our NKC Health YouTube channel with multiple videos on health-related topics. Several from Stephanie on there. You'll see her face. And also, please remember that we have lots of community engagement activities and educational offerings. If you go check out our website, nkchealth.org, there is a classes and events tab, and that's where we list all the things that we're doing out and about and online. So thanks for joining us. Thank you, Stephanie. You guys take care. Have a good one.
Have a good day.
Bye.